the screencast. All right, here we go. So if you have questions, like I said, shout it out or send me a message or put it in chat, but I won't be able to see the chat until the end. If you have technical difficulties, make sure you send me a message on my phone. So we are going to talk today about the digestive system. We haven't really gotten to talk a lot about this, but it's obviously a very important body system that a lot of people think that they know about. And there's a lot more details of it that you should know as future health providers. So here we go. What I want you guys to know as a result of this or with any body system is to know the anatomy and the functions of the anatomy of the body systems, to know some common diseases, to know what happens through the lifespan or the age-related changes, and some diagnostic tests, as well as some common diseases. So I'm going to go through a couple of those common diseases with you, but I have a couple of short videos for you. They're each, I don't know, 3 or 4 minutes long, I think. So we'll do this one first. Hopefully I picked the right one.
Across the whole planet, humans eat on average between 1 and 2.7 kilograms of food a day. That's over 365 kilograms a year per person, and more than 28,800 kilograms over the course of a lifetime. And every last scrap makes its way through the digestive system. Comprised of 10 organs, covering 9 meters, and containing over 20 specialized cell types, this is one of the most diverse and complicated systems in the human body. Its parts continuously work in unison to fulfill a singular task, transforming the raw materials of your food into the nutrients and energy that keep you alive. Spanning the entire length of your torso, the digestive system has 4 main components. First, there's the gastrointestinal tract, a twisting channel that transports your food and has an internal surface area of between 30 and 40 square meters, enough to cover half a badminton court. Second, there's the pancreas, gallbladder, and liver, a trio of organs that break down food using an array of special juices. Third, the body's enzymes, hormones, nerves, and blood all work together to break down food, modulate the digestive process, and deliver its final products. Finally, there's the mesentery, a large stretch of tissue that supports and positions all your digestive organs in the abdomen, enabling them to do their jobs. The digestive process begins before food even hits your tongue. Anticipating a tasty morsel, glands in your mouth start to pump out saliva. We produce about 1.5 liters of this liquid each day. Once inside your mouth, chewing combines with the sloshing saliva to turn food into a moist lump called the bolus. The enzymes present in the saliva break down any starch. Then your food finds itself at the rim of a 25 centimeter long tube called the esophagus, down which it must plunge to reach the stomach. Nerves in the surrounding esophageal tissue sense the bolus's presence and trigger peristalsis, a series of defined muscular contractions. That propels the food into the stomach, where it's left at the mercy of the muscular stomach walls, which pound the bolus, breaking it into chunks. Hormones secreted by cells in the lining trigger the release of acids and enzyme-rich juices from the stomach wall that start to dissolve the food and break down its proteins. These hormones also alert the pancreas, liver, and gallbladder to produce digestive juices and transfer bile, a yellowish-green liquid that digests fat, in preparation for the next stage. After 3 hours inside the stomach, the once shapely bolus is now a frothy liquid called chyme, and it's ready to move into the small intestine. The liver sends bile to the gallbladder, which secretes it into the first portion of the small intestine, called the duodenum. Here, it dissolves the fats floating in the slurry of chyme so they can be easily digested by the pancreatic and intestinal juices that have leached onto the scene. These enzyme-rich juices break the fat molecules down into fatty acids and glycerol for easier absorption into the body. The enzymes also carry out the final deconstruction of proteins into amino acids and carbohydrates into glucose. This happens in the small intestine's lower regions, the jejunum and ileum, which are coated in millions of tiny projections called villi. These create a huge surface area to maximize molecule absorption and transference into the bloodstream. The blood takes them on the final leg of their journey to feed the body's organs and tissues. But it's not over quite yet. Leftover fiber, water, and dead cells sloughed off during digestion make it into the large intestine, also known as the colon. The body drains out most of the remaining fluid through the intestinal wall. What's left is a soft mass called stool. The colon squeezes this byproduct into a pouch called the rectum, where nerves sense it expanding and tell the body when it's time to expel the waste. The byproducts of digestion exit through the anus, and the food's long journey, typically lasting between 30 and 40 hours, is finally complete. TED Ed is a nonprofit.
All right, so there's the rest, or that's the end of that video. Let me go back here. And then this next one is a little bit shorter, but I think it does a really cool job of showing how the food goes through the body, and it's like a 3D animation. Yeah, it's about 3 minutes.
Is an amazing one. The food that you eat is broken down, firstly by chewing and now in the mouth. Fashion as a wall or rolls with the help of an arm. A little bridge called the epiglottis close over to protect your airways so that the food doesn't go down into your lungs every time you eat. During swallowing,
And the epiglottis we talked about in the respiratory system.
Of the food pipe known as the esophagus. Starting in the esophagus, an amazing action called peristalsis takes place, and we can see that here. Think of peristalsis like the movement of a worm crawling on the ground. Peristalsis is powered by muscles inside the gut itself and is the force that enables the food to travel from the esophagus to the stomach and all the way down to the anus. The stomach is a J-shaped moving container full of acid. The folds of the stomach that we can see here are called rugae. As the food bolus arrives in the stomach, it causes the stomach to stretch, and a lot of enzymes and acid are produced. These help to break down or digest food. Once eating starts, the lower part of the stomach is constantly churning like a blender, and most of your food is broken down into tiny particles no more than 3 millimeters. The small size of the particles allows it to easily pass into the small bowel. Now this pulpy, acidic mash enters the very long, windy tube known as the small bowel. The mash is digested with the assistance of a flat, pear-shaped gland known as a pancreas and bile. The pancreas produces a number of enzymes that are really good at breaking down proteins into small amino acids. Bile is a yellow-green, sticky fluid produced by the liver, and it acts like a detergent to break down big clumps of fat into little fat particles. The small bowel also contains enzymes that help digest carbohydrates into simple sugars like glucose. We're traveling through the small bowel now, and yes, as you can see, it is very long indeed. In an average adult, it measures around 6 meters in length. Right now, it feels almost like we're in a roller coaster. Amino acids, little fat particles, and simple sugars can travel through the cells lining the small bowel and into the bloodstream. This process is called absorption. It means that nutrients can get to different parts of the body where they are needed. The small bowel absorbs almost all food nutrients and minerals such as iron. Any food that is not digested by the small bowel, such as fiber, enters the large bowel or colon. In the colon, a lot of water is taken away from the food, making it more firm. A lot of bacteria is present in the colon, and after processing food, they can produce gas and short-chain fatty acids. Short-chain fatty acids are valuable nutrients for the cells lining the colon. The indigestible, dried food product now becomes waste. It gets stored in the last part of the colon, known as the rectum, and now is ready to leave the body's poo during a bowel motion.
All right. So I really like that video. Let's stop that. Go back to my screencast. Okay. So moving on, the function of the digestive system then is to absorb nutrients from the food that we eat so we can create fuel or energy and nourishment for all of the cells in our entire body. So after a while, around lunchtime, when you're feeling really sluggish and you're starting to get really, really hungry, it's your body telling you that you're low on fuel, you're low on energy and nourishment for your cells. So you have to eat something that will replace some of those fuels. So if you are really, really low on protein and you don't take in any protein, you won't necessarily feel better until you gain some protein in your diet. But our digestive system does have many different ways to compensate for the lack of certain vitamins, minerals, or proteins as well. Like we can break down fat to gain glucose, for example, if we didn't take in any sugars or carbohydrates. All right, so the digestive system is one long tube, as they said in the video. So it starts with our mouth, it ends with our anus, and along the way, there's little pouches that help and aid in digestion, but even the stomach is just an extension of that long tube. It's just a widening of that long tube, which is approximately 28 feet long total. Those compartments that I talked about are the mouth, the pharynx, which we know from the respiratory system is the throat, esophagus, which sits right behind the trachea that we just learned about, stomach, small intestine, large intestine, and anus. Okay, and then we have liquids that are sent into our digestive system from ducts, like our salivary glands in our mouth and the sides of our cheeks. Parts of the pancreas aid in digestion, but the biggest part for the pancreas is creating a balance or homeostasis with the blood glucose. So if you're diabetic, you've got some problems with your pancreas. The liver and the gallbladder also assist with digestion. All right. For the most part, we think of food in terms of starches, proteins, and fats. And by starches, that is typically means carbohydrates like breads, pasta, potatoes, that kind of stuff. So to break down those large molecules of the bites of food that we take, different things have to happen in the digestive system. So peristalsis, which is the muscular contractions of the tube of our digestive system, helps move food along. So if you've ever swallowed something like a really, really big bite of food and you feel like it's caught like midway in your chest, typically that is peristalsis kind of struggling to move that food where it needs to go down to the stomach because either the bite was too big or it was too dry or it was too sharp or something. So if you get that feeling when you eat, sometimes it is constricted in there, and peristalsis is working really hard to still try and move that. Secretion is the release of digestive juices. Digestion is mechanical, like chewing, and chemical breakdown of the food. The chemical breakdown is done by the secretion of those juices. And then absorption, which of course is what we're wanting. So the passage of the molecules into the body's interior and into the vascular system to nourish all of those tissues. And then, of course, elimination of the remaining excess portions, which we know as stool. All right, here's all the components kind of all laid out, including the small intestines sections and the large intestines sections. So they all have a different name based on where they are. So for example, the ascending colon is this side of our large intestine. Okay, it's called ascending because it's moving up. And then the transverse colon, which kind of goes in and out through some of these organs, it literally is lying transverse or horizontal. And then here's the descending colon, which goes down. And then right here is called the sigmoid, and it's kind of S-shaped. So I've always been able to connect those two and help to remember the S-shaped sigmoid, and then the rectum. Okay, but it outlines the other portions as well. All right, so here's some anatomy. The mouth and salivary glands, which is similar, it overlaps with the respiratory system because not only do we take food and liquids in through our mouth, but also oxygenated air. So we share that with the respiratory system and then it moves down. Instead of going into the trachea for breathing, though, we swallow and the epiglottis closes off that trachea so food can go behind that and meet the esophagus. And you'll notice that there's some different spellings of esophagus. In more Latin speaking areas, they will add the O, but typically here we just say esophagus. There's salivary glands on the side right in front of your ears. You can feel those. And sometimes if you eat something really, really sour or really, really sweet, you can feel that tingling motion right over your jawbone, right here on both sides, because the salivary glands are secreting a bunch of juices to help break that down. And then underneath your tongue, there is salivary glands as well, and then throughout a couple different areas of your mouth. But here we come down. This is the stomach. The liver sits to the top right side of your abdomen with the gallbladder kind of tucked in right here because they work together, and it sits overlapping the stomach. Here's the spleen over here. And then the pancreas is tucked kind of up and behind the stomach. Okay, and then the large intestine and the small intestine. The large intestine, they will sometimes call the colon. Okay, if we were in class, this is the diagram that you guys would be learning. All right, anatomy of the mouth and throat. Obviously, this is our tongue. This is the uvula, which can help signal to our digestive system that food is on its way. Here's the tonsils. If you've had your tonsils removed, I know a couple of you guys did this year. This is tissue that sits just on the side. Okay, the soft, squishy part of our palate, and then the hard palate right here. So you'll know you're past the hard palate if you push your tongue to the roof of your mouth, and you can have like a little bit of give right there. But underneath our tongue are the ducts to your salivary glands. And you can actually see those if you lift up your tongue. Okay, and then we've got this frenulum here that helps hold our lip to our teeth. And we've got a frenulum up here that helps hold our upper lip. And I've seen a lot of kids with injuries where they rip that right off, and it typically will reconnect itself and go back together. All right. Over here, very similar to the respiratory system, but now we have a bolus of food in there. And here is the epiglottis that's going to close off this trachea so food can sneak right behind and go down the esophagus. Okay, here's the bones that create that hard palate on the roof of our mouth, and then the tissue that goes right over it. And then that bone ends, and we've got this squishy area right here. And then here's the opening from our nasal cavity, and it will go right down into the esophagus as well. All right, so the salivary glands are found in and around your mouth. They secrete saliva. Okay, here is a diagram showing those parotid salivary glands right in front of the ears, and then the tube and where it leads to secretion in your mouth. And that duct is a little bit harder for you to see, but you can see it if you look really close. And then here is the sublingual, or under the tongue, salivary glands. Okay, besides those glands, there are tiny glands in your inner cheek and in the linings of your mouth and throat that secrete even more saliva. All right, teeth, they tear, crunch up, and help make those chunks of food small enough where they can be broken down in the stomach. So that is what we consider mechanical breakdown for the digestive system. So people without teeth, they have to really be careful of what they eat, because They can't swallow it, so they have to eat softer foods. And if they were to just swallow large portions of food, like a piece of steak, for example, that wasn't chewed up at all, their digestive system would have a very hard time breaking that down into a molecular form for absorption. So it may or may not even get absorbed at all, and it would end up coming out with the waste products. So teeth are very, very important. The tongue, way back at the back, you may have seen these. The large taste buds on the back, they look like big red spots, and sometimes people think that something's wrong because typically you don't get to see those. But if you stick your tongue out very, very far and look in the mirror, sometimes you can see those. And then the small taste buds, we have different regions of taste on our mouth, but you obviously can see those very, very easily, and they pick up different sensations. Okay, here's the epiglottis again, the tonsils at the back of the throat. The projections or papillae are what give the tongue its rough surface within the taste buds. Okay, the appearance of the tongue is often an indication of your health. So if you have a very, very dry tongue, that tells us that you're probably dehydrated because you're not producing saliva. It also can tell us if you've got blocked or cancerous salivary glands, for example. If your tongue is very, very pale, that can tell us that maybe you're anemic, and it just gives us a lot of indication of your overall oral health as well. All right, the esophagus, it's about, some sources will say 10 inches, some will say a foot, and of course, it's smaller if you're smaller. So kids have a much shorter esophagus, but it doesn't just remain open like as a tube. It's kind of flaccid. It doesn't have the cartilage rings that the trachea does to hold it open. So until there's food introduced, your esophagus is actually squished kind of flat. And then once food is in there, peristalsis helps propel it towards the stomach. Okay. The esophagus is lined with a type of tissue. You'll learn about when you take biology or college anatomy, but it's called stratified squamous epithelium, and it's one of the toughest tissues in the human body. So it can handle quite a bit of friction and rigor from the things that we eat. They're lined with mucus glands that continue to lubricate that food so that you can create a bolus of food that lands in your stomach. All right, and here's actually a picture through a scope that someone was having called an EGD, which is a very long word, esophagogastroduodenoscopy. So if they're having trouble with their stomach or their esophagus, they would put them to sleep and put a long scope down their throat. And if they were going into the lungs, it would be called a bronchoscopy. But this is called an esophageal scope or EGD. And so here's a picture of the sphincter at the top of your stomach. So this is all the esophagus, and then this is the esophageal sphincter that opens and closes to help prevent like acid reflux. So people that have problems with this esophageal sphincter might experience a lot of acid reflux, but right now they're showing it kind of open. So this upper sphincter relaxes to let food enter, and then the lower sphincter relaxes to allow food to pass into the stomach. Okay, here's an animation kind of the peristalsis. Here's the food bolus. The esophagus squeezes above it and then helps push it downward. All right, so the stomach is supposed to store the swallowed food. It's supposed to mix up the food and then empty its contents into the duodenum, which is the first portion of the small intestine. But the stomach, in that one video, it showed all the rugae, which is absolutely correct and gives it a lot more surface area for absorption. But it's a layer and layer and layered organ of muscle because it has to really churn and mix up the food. So there's different areas of the stomach, and probably the most important one to know is that this is the fundus. Okay, this is the opening from the esophagus and that sphincter. down there. But there's another sphincter called the pyloric sphincter at the bottom of the stomach. So it also has to open to dump things into the small intestine. All right. In terms of the different things that we break down when we eat, in terms of starches or carbohydrates, proteins, and then fats, carbohydrates spend the least amount of time in the stomach because they're really, really easy to break down. So if you think about putting like a rubber bouncy ball in a glass of water, or putting a piece of bread in a glass of water, the bread or the carbohydrate is most easily going to break down as it sits into that water. And can you imagine how that would increase if we put it in a cup of stomach acid? So it doesn't take long at all. It's in and out of the stomach. Fats, on the other hand, like the rubber bouncy ball example, they take a long time to break down because the acid doesn't as easily break them down. So they spend more time in the stomach, and they require other juices in order to break down. And then kind of midway between both of those is proteins. And what's a good example of a protein? So something that's a little bit harder to break down, I guess cheese, would be the best example, just like they show here. But if you were to put cheese and leave it sit in water or stomach acid, it would take longer than the bread, but not as long as the fat to get squishy. All right. The liver actually has a lot of important functions. And when people think of liver, they typically think about how it's affected by alcohol and liver cirrhosis as a result from, a lifetime of alcoholism. But its job is actually really, really important. It is one of the largest, or the largest full organ in the body, and it's separated by other lobes. So people could have like a section of their liver taken away and it could still kind of work. But one of the biggest things that the liver does is it's a filter. So it filters your blood, but it also helps your digestive system because with the gallbladder, it secretes stomach acid or bile into the stomach to help break down those fats. So if you don't have a gallbladder anymore, or you have damage to your liver, your body can't break down fats very well. So the patient ends up getting frail, dry skin, losing a lot of weight and muscle tone because you can't absorb fats. Fats in excess are bad, but your body also needs fats to maintain function. It's right below the lungs here, sits just below the diaphragm. Okay, and it performs more than 400 functions, and I outlined just a couple for you, but it helps convert food into nutrients by producing bile. It also stores fats, sugars, iron, other things that you take in, so that if you go for a prolonged period without eating, that's kind of like the backup storage area. It makes proteins that aid with clotting. And my pop-up keeps coming up on the bottom, so I can't see my slide. And it helps remove toxins. And that is where the problem comes when you consume too many toxins, either with drugs or poor food or alcohol. Once it's filtered so much, it can absolutely wear out, and you can get liver cancer or cirrhosis of the liver. So it has a lot of things that it does. And there's a picture of it, a big enlarged picture. But the gallbladder, they always have it in green. It's not really green, but since it secretes bile, they usually color it green. Here's the right and left lobes. And then the inferior vena cava sits right behind the liver. And the inferior vena cava, remember, brings blood up to the right side of the heart. So if you have heart failure, usually you end up with problems with your liver too because of that backup of blood. All right, pancreas, I always think it looks a little bit like a shoe or a fish, but it is important in controlling glucose. And like I said, if you're diabetic, you have a problem with your pancreas. So it is not as bright pink as like the liver. They say grayish pink. It's just, I guess, a little bit more dusky colored, but It secretes glucagon and insulin into the digestive system based on how much sugar you took in. So if you remember, carbohydrates, which are breads and pies and cakes and pretzels and all that kind of stuff, those are carbohydrates, easily broken down in the stomach because just like with the glass of water. But if you take in a whole bunch of carbohydrates, those are converted to sugar in your digestive system. And the pancreas gets the alert that your blood sugar is way too high, so it will secrete a bunch of insulin so that it regulates that glucose amount, because too much glucose for your cells is bad. But if you aren't taking in any glucose, like you haven't eaten in a whole day or a couple of days, the body will break down fats to use as sugars, and the pancreas will secrete something called glucagon, which is like a stored sugar so that your cells can still maintain some function. So if you go for a really, really long time without eating, sometimes so much time passes that you're not even hungry anymore. And that is partly because of what the liver secretes to keep you going with the stored nutrients, and also the glucagon that the pancreas secretes to keep you going. All right, here's a little bit more information about the pancreas and just the cells that do the secreting. And I'm not as worried about you knowing exactly which cells do what, but basically the beta cells and the isolates of Langerhans are what work to create insulin and glucagon. All right, the gallbladder, the thing I said, is always green and sits down behind the liver. It kind of connects with the liver to secrete bile. Can you guys please be quiet? Gally? Sorry about that, you guys. So it is pear-shaped, but it's like longer than a pear. It's pretty small. It's probably about as long as the palm of your hand. And here's some different conditions of the gallbladder. So here's gallstone sitting in here. This one's showing a cyst in the duct that's creating it to be like blocked or greatly enlarged. Cholecystitis is a long chronic condition where it is long term and it just kind of atrophies or fades away. And here's cystitis, cholecystitis, where it's just inflamed because maybe of an infection or something like that. But that is acute. So it typically goes away and lasts a short time with antibiotics. But during a fatty meal, the bile that's secreted help dissolve that fat. Right? And then here's how they kind of lie together. So here's the gallbladder, which sits behind the liver, which would be right here. And then the pancreas, which sits behind the stomach, but they kind of took the stomach out for this picture. And then here's the small intestine, but they wanted you to be able to see what was behind the stomach and the liver, and how the ducts move right into the wall of the intestine. All right, the small intestine. Okay, like I said, the first section of that is the duodenum right here, and they cut the stomach off again. Here's the mesentery that they were talking about, which is that tissue that kind of holds everything in place. And it's about 6 meters in length, all folded and pushed into our abdomen. Here's a picture of a cadaver, small intestine, and there's the mesentery holding it all together. So it's not like they're just all pushed in there and can fall all over the place. They're held together. Okay, and there's another picture. Okay. The small intestine, it's longer than the large intestine, but it's smaller around. So that's where the name small intestine comes in. 90% of your food, nutrients, all of that are absorbed through the walls of the small intestine with that villi that they were talking about. And then the capillaries that go inside the villi are able to absorb those nutrients on a cellular level. Okay, and here's a close-up of those villi. They are really, really small. And each one of these little pieces right here is one cell. And then the cells come in close contact with the arterioles and the venules and the capillaries. So there they're showing all the microvilli, and that is on the wall. Okay, the large intestine comes next. It connects to the small intestine. Here is a picture of the appendix, which is just it's a very small little portion off the side of right where the small intestine meets the large intestine. It's wider and shorter than the small intestine. It's about this one says 5 feet. I would say it's 3 to 5 feet, depending on how big you are. And the inner wall of the large intestine is smooth and shiny, where the small intestine has all those villi. So as it moves through the digestive process, that food or that bolus, there's different secretions. And then the large intestine starts absorbing a lot of that water from that solid waste matter to create stool. So it's absorbing a lot of that liquid. So if you can imagine, if you have had a colectomy or removal of your large intestine, and they have had to use your small intestine as the opening to your rectum, your stool would be very, very watery because you don't have your large intestine for all of that chyme to move through and be absorbed out of there. So dehydration would be a major issue for a patient with less than their full colon. Okay, there's another picture. Here's the ascending, transverse, descending, and then the sigmoid. And then the appendix, which helps with some more secretions. If you've had your appendix out, you'll notice that you can still survive. It's not something that's required. It just helps with further breakdown of food. But a lot of times they become infected or something that we call appendicitis, and they have to go in and remove that. Okay, so after you swallow, we'll just run through this, how food goes through. So food is broken down and mixed with saliva with chewing. The epiglottis closes the pathway to the lungs, and we swallow, allowing muscle movements to send the food into the esophagus and the stomach. In the stomach, food is broken down by enzymes and turned into chyme. The food moves into the small intestine, where it is still being digested and mixed in with the liver, pancreatic, and intestinal juices. From there, digestive nutrients are absorbed through the intestine wall into the bloodstream, like we said in the small intestine. And the remaining parts of the food are then moved into the large intestine, where they remain for a couple of days, unless you're having diarrhea, for a couple of days. And then when they move into the rectum, it gives us the signal that there are contents to be expelled, and that would be our bowel movement. All right. This is a list of a lot of different diseases because there are a ton of different diseases of the digestive system. For example, kidney stones, constipation, excessive gas, appendicitis, cancers, irritable bowel syndrome. There's a lot of different things. So I'm going to just highlight a few of them. Okay, appendicitis. Here's a picture under a surgical scope of an inflamed, infected appendix, and it affects both sexes equally. It's more common in men, though, between puberty and 25 years old. So typically for females, it happens younger in life, and then for males, a little bit older in life. Here is a gallbladder that's completely filled with stones, and that's from a cadaver. So the gallbladder gets infected because gallstones block the duct or the passageway, so the bile can't get out. And then you end up with inflammation and severe pain, and they typically have to go in and take that out. Cirrhosis. So here's a healthy liver, and then here's an unhealthy cirrhotic liver. It's usually a result of alcoholism, but it can be from other toxins that people take in too, or just genetics. So anytime you see a patient that has a diagnosis of liver cirrhosis, you don't assume that it's alcohol abuse, but it would be highly likely until you look further into their history. Colorectal cancer. Here's a picture of how they start off as a polyp, and they grow right through the wall. And then the cancer can spread throughout the body. But here's a picture of a cancerous colon. So they recommend to do screening called a colonoscopy for people 50 and over, but now they're starting to see it even younger and younger. So if you have a history of digestive symptoms or disease, then they recommend you do a colonoscopy even earlier because it's so preventable. If they can get in there and find the mass when it's just a teeny tiny polyp, then you can live and go on with your life. But if you don't do anything about it because you didn't know you had it and you end up with this, that usually results in stage 4 and leads to death. So it's the second leading cause of cancer-related deaths, but it's the third most common cancer. And it is the only preventable cancer. So you literally, if they get in there and they take out what they call these little polyps, they can completely prevent you from developing cancer as long as you're going in for your screenings as recommended. Crohn's disease, that's a problem with your autoimmune system. So your body's kind of attacking itself. It causes the colon to be very red and inflamed, and the wall to slough off and be very, very irritated. So it's like ongoing inflammation. Diverticulitis, it's like little pouches that develop, and you can see them right here in the inside of the colon. And this is a picture directly through a colonoscopy, a scope that's actually in the patient's large intestine. And food and other particles can get caught in there and it can be painful. Irritable bowel syndrome, very, very common. Sometimes it's a result of dietary factors like gluten, if you are sensitive to gluten, or you eat a lot of things that are high in acid or gas producing. It can result in irritable bowel syndrome, which can be extremely painful as the colon actually starts like spasming and pinching and twisting, resulting in diarrhea, alternating with constipation. And stress, too, can really cause irritation in the bowel. Our gut seems to respond highly to our mental health. Okay, GERD is acid reflux because of that sphincter that I was talking about. It doesn't close up. Okay, liver cancer. And they show the mass right here. Okay, celiac disease, which is a problem with gluten. Pancreatic cancer. And that is highly linked to the inhalation of carcinogens, all kinds of different things. All right, PUD, or peptic ulcer disease, is a problem with ulcers, and they show a little picture here, and this is one through an actual scope of an ulcer in the stomach. And they used to think that that was the result of stress, but we now know it's caused by a bacterium called Helicobacter pylori. And so if you're having a lot of symptoms that they think lead to the diagnosis of an ulcer, they will actually do a scope and test the liquid in your stomach and look for that bacterium. If you are someone who takes a lot of anti-inflammatory drugs like Motrin, that can lead to the breakdown of the lining of the stomach and ulcers there as well. All right, a couple more slides here just with some pictures, but esophageal varices are like bulging vessels in the esophagus as a result of long-term, like severe alcoholism, basically. And it's typically associated with hard liquor. But what happens is these bulge so much that they can actually burst, and it's coming right from that inferior and superior vena cava, backing up that pressure into the esophagus. And if they burst, the patient can die suddenly because they lose so much blood all at once that they typically can't even get them to the hospital, or let alone back to surgery to save their life. So esophageal varices are can be a death sentence. Oral cancer on the side of the tongue there. Some information on IBS, very, very common torsion and pain with the intestine. And they've got some treatment, but it's finding out what those trigger foods are that are the biggest challenge for IBS sufferers. All right, liver cirrhosis. Your patient typically looks like this, very, very yellow, distended gut because liquid fills the abdomen. And then again, some pictures of the liver. Okay, few more slides, guys. Hang in there. Some different tests. They can do swallow tests and enemas to look for tumors, strictures, and ulcers. The endoscopy procedures I was telling you about, they can put the scope down the stomach or they can go into the colon. And that long word that I was telling you about is the esophagogastroduodenoscopy, or EGD. That's one type of endoscopy, but the word endoscopy actually means scope of the inside, if you break that down. They can also do x-rays and blood work, as well as ultrasounds, CAT scans, and MRIs to look for changes in structure and function. Okay, the effects of aging as we get older. It doesn't have a ton of effect on our digestive system, but it's just kind of how we've treated it through our lifespan. So chewing can become more difficult as our teeth begin to break down. If they have poor dentition or no teeth, it's a major, major problem. So dentures can be very important for people who have had all their teeth removed or pulled. Our lactase levels decrease. So we don't tolerate dairy products as well as we get older, and most people end up developing lactose intolerance. Constipation is more common because elderly or older people, they aren't moving around as much. They aren't getting exercise and that good blood flow to their digestive tract. Excessive growth of certain bacteria becomes more common and can lead to pain, bloating, and weight loss. So they might not be able to break down foods as well, and that creates that gas and overdevelopment of that good bacteria. Decreased secretion of saliva. The overall structures like the pancreas, liver, and gallbladder decrease in weight and can kind of atrophy or shrink up a little bit. And elderly patients are more prone to those ulcers. And then I think this is our last slide, but fun facts: chewing takes from 5 to 30 seconds and can stay in your stomach for up to 4 hours. We produce a ton of saliva each day, and therefore we have to keep drinking more water to prevent becoming dehydrated. And the adult stomach can hold about a liter and a half. So if you think of a 2-liter bottle of pop, we have almost that much in saliva per day, but we can fill about 1.5 of a 2-liter bottle with food per meal. Now, if someone is used to eating a large amount, then obviously their stomach becomes able to hold more and more of that. But if you are used to eating a lesser amount and your stomach isn't used to getting expanded or stretched to that amount, then you may feel full with a lot less food. The average male will consume about 50 tons of food just to sustain a weight of even 150 pounds. And there are more than 400 species of bacteria in the colon. One of those is Escherichia coli, or E. coli, which if we get it in our mouth, it can cause severe poisoning, but it is a bacteria that's needed in the colon to break down and create stool. Most of us produce 200 to 2,000 milliliters of gas each day in roughly 13 to 14 passages. So it's very, very normal to have gas and need to expel that. Our culture, though, does tell us when is an appropriate time to do that. And we've learned a certain amount of etiquette, just like with cough etiquette, for expelling that gas. So all right. Are there any questions? I'm going to go back out. I'm going to look in our chat and see if we have